So today we'll discuss about the corrected potassium levels in ICU. Very important but neglected key parameters. Without any ado, we'll start with the notion of the inverse relationship between the serum potassium and the pH level. So for every 0.3 milliequivalent per liter decrease of the potassium, your pH rises for 0.1 unit, and vice versa for every increase of potassium, that is 0.6 millimole per liter, your pH decreases by 0.1. So let's move on to a case. Here you are having a pH ABG of a patient who is having a pH of 6.9 and potassium level of 6.2. So with 6.9 pH in blood, you will suspect it to be having acidotic component, and the potassium level in serum, that is the report which we get, not in the ABG, you are having 6.2, you will certify this patient to be a hyperkalemic patient, and you might have this reflex of correcting this patient by insulin or K binders and other maneuvers. But no, this is not the case. So here we have to see that what is the difference between the normal pH and the pH which we are getting in the patient, and accordingly we have to see how much potassium should have been rose in the ideal case. So here the difference between the pH is 0.5, which is clearly visible, that 7.5 minus 6.9, this is the 0.5, and for every decrease in the pH of 0.1, the potassium should have been increased by 0.6 millimole per liter. So the decrease in pH is like 0.5, and potassium according to this formula would have been increased by 6 times. So 0.5 into 6, so the ideal potassium should have been 3, the increase should have been 3. So what we have to do for corrected potassium level is we have to subtract the the increased component from the 6.2, that is 6.2 minus 3 is the corrected potassium level, that is 6.2 minus 3 is coming 3.2. So the ideal increase should have been 3 milliequivalent per liter, but what you are having in your serum report is 0.2. So just subtract that parameter, that is 6.2 minus 3 is the 3.2, and this is your corrected potassium level. So this is a potassium level which is actually the truthful potassium level in that patient. So now you can see that this patient is actually hypokalemic, not hyperkalemic. On first hand, we were suspecting it to be having a hyperkalemic component, but after like calculating the ideal potassium level, we are now in a state that we know this patient is in actually hypokalemic condition. Now wonder if you have started correcting this level, this truth level, this ideal, not ideal, but the actual level of 3.2 by using insulin, you would have further led this patient into hypokalemia, like and ventricular arrhythmias and many sorts of arrhythmias. So don't go for the first notion that your patient is 6.2 with potassium level, so it's hyperkalemic. No, you have to correct the potassium level, the actual potassium levels, by this calculation, and then start the treatment of that patient. And you can also use this medical calculator. So here only I have put the like the similar parameters. These are the serum potassium level, which was 6.2, the pH initial, that is the ideal, which we consider 7.40, and the pH which we had that in the patient, and that is 6.9 acidotic. So after putting the value, just click on the calculate, you will have the accurate potassium levels, the potassium level after correction, that is 3.2. So basically what you are having is, यहाँ पे you are having 6.2 2, which is a hyperkalemic state, but actually your patient is hypokalemic. So don't treat this patient with insulin. Otherwise, you will make the hypokalemia even worse. So stay tuned and read more about this. Thank you.